The following segment is sponsored by Northern Nevada Health System.
We're here at the beautiful new ER, an extension of the Northern Nevada Sierra Medical Center, with Mike Tobin, a registered nurse here at this beautiful new ER. Mike, good to see you. What's the difference, by the way, of like a hospital ER versus one of these freestanding ERs?
Yeah, so the ER at Damati Ranch is an extension of Northern Nevada Sierra Medical Center. And the best way to describe this ER is that we are, if the main ER were to add an extra 10 beds, that's what this is. We can treat any patient that comes in, and then we can definitively take them either as a discharge or we could transport them to a hospital.
So speaking of a hospital, what conditions are treated exclusively at a hospital ER versus here?
There's actually not any difference. We have all the same medications, all the same equipment, we have all the same diagnostics. If the patient did need to be transported to a hospital to be admitted, then we could do that by using our local EMS partners and transporting them to one of our local hospitals, preferably Sierra Medical Center.
So technology is such a big part of what you do in the ER. Can you kind of describe what technologies we might see here and at the hospital ER?
Yeah, so we do all the same services that an ER would do. We do blood draws, we do imaging, which includes CT, x-rays, ultrasound. We would be able to use those imaging and studies to diagnose a patient and be able to effectively treat them.
Speaking of treatment, one of the biggest things I'm sure you see are heart issues, heart attacks, stroke, that kind of thing. When it comes to a hospital being chest pain certified, what does that certification mean to you guys in the front lines?
Yeah, so a stroke accreditation and a heart attack accreditation is an accreditation that is evidence-based, and it's a standard across the whole country. So it allows us to treat a patient in a very effective way so that we can see positive patient outcomes. And so if a patient comes in with stroke symptoms or heart attack symptoms, we would treat them, we would stabilize them, and then we would emergently transport them to the main hospital so that they could be taken to a cath lab, or if they had to be taken to the OR to have a procedure done.
Yeah, good to have you guys here because this area in South Reno is growing so fast. You're surrounded by a lot more people than you would have been some 20 years ago. Mike, good to see you. Appreciate it.
Yeah.
And for more on this, just go to our website, foxreno.com.